To the matter in hand, Andy Tatem is a professor in geography and environment at the University of Southampton. He's director of the World Pop and Vector-Borne Disease Airline Importation Risk Research Projects and co-director of the Flowminder Foundation. I could go on, but I would just like to say that I interviewed Andy when he was part of a team applying to the Wellcome Institute recently under their Sustaining Health initiative, and not wishing, well, actually I do wish to embarrass him in public, without betraying any particular truth, the panel was blown away by the excitement and vigour of Andy's team. And I'm therefore delighted that he's accepted the invitation to give the Beveridge Lecture on mapping progress towards the Sustainable Development Goals. Andy Tatem.
Thank you all for coming, and missing Portugal versus Hungary, I think, is on at the moment. So I'm going to talk, as you see, about mapping progress toward the Sustainable Development Goals, and starting off with, here's some news. And if you were to read newspapers nowadays, well, newspapers throughout all time, you get a pretty bad impression of the world. We've got flood crises, we've got the law not protecting us from criminals anymore, we've got a Zika epidemic coming, secret tax bombshells, terrorist attacks, we're completely screwed with climate change, death everywhere, England team, that's probably not news. And then tomorrow will be World War III, apparently. So, are things really so bad? Here's a little animation going through the last 100 years from Gapminder. Look at income per person, life expectancy for all the countries in the world, and you'll see a good news story. I think there are dips and there are jumps of countries, but continually, all the countries are pretty much moving to that top right corner. We're all getting richer, we're all getting living longer and healthier lives generally. And we get there eventually to 2015, I think, or 2011, we'll stop. And if you look at some of the stats here, in the last 15 years, under 5 mortality rate has halved, infant mortality rate similar, neonatal mortality rate. Consistently by region, on average, we're living longer, we're getting richer, GDP across all regions, again, increasing. Part of the reason behind this are the focus of the United Nations, of governments, particularly over the last 15 years, from 2000 to 2015, on the Millennium Development Goals, and giving governments something to focus on and try and achieve in terms of a range of different goals, so reducing child mortality, improving maternal health, and each one of those has a specific statistics that governments try to achieve. But as you saw by that scatter, global inequalities exist between countries in terms of health, income, but also within countries as well. So while around 1/3 of developing countries reduced child mortality by 75% in the last 15 years, a big achievement. Another 74 cut it by half. But huge subnational inequalities remain. So if you look at, for example, there in Niger, near the left, we see a huge range of under 5 mortality rates between the best region and the worst regions of the countries. And it's because the Millennium Development Goals were measured at a national average, you could reduce the child mortality in your biggest city and probably achieve that goal and forget the rest of the country. So there were problems with the MDGs, which the most recent round of goals are trying to fix. So the Sustainable Development Goals, initiated last year, big fanfare. We had world leaders talking, presenting them. We had some celebrities, actors here, choosing their favorite goal. We even have TV chefs. We have Ban Ki-moon there, great meeting of minds, meeting Shakira. We have the UN kind of berating themselves to get the job done. And so the SDGs, the Sustainable Development Goals, are 17 goals made up of 169 different targets, so a pretty complex undertaking. But some of the key differences compared to the Millennium Development Goals from the perspective I'm going to talk about is that there is this change of trying to leave no one behind. So no goal should be met unless it's met for everyone. So eradication of extreme poverty is an example there. Nobody should be living in extreme poverty. And there's a focus on achieving X, Y, Z, all the different goals everywhere. So geography is important. Obviously, I'm biased in saying that, coming from a geography department. But if we're going to achieve it everywhere, we need to measure it and map it everywhere. And so let's need some important data. They're all SDGs and the Millennium Development Goals were based on ensuring a certain percentage of the population has access to specific services or resources, or achieves a certain level of social, economic, or physical health. So all of them involve measuring numbers of people, having a denominator, and improving that understanding of subnational geographic variation and inequity is increasingly recognized, as I mentioned, as central to meeting those goals. So to do that, we really need a consistent, comparable, regularly updated. Remember, we're going from 2015 here to 2030 and want to try and measure, monitor that progress in achieving those goals. Evidence-based of not only how many people live in a country for the denominators, where those people are if we're going to focus subnationally, and who they are if we're going to focus on health status, wealth, and particular vulnerable groups. So, census data, you're familiar with, I guess, can provide those answers. So, and when it's very good, high-quality data, this is data from northern Namibia at very small administrative unit level, and for each one of those units we have an estimate of the number of people, their age structures, so we can pick out those vulnerable groups, under fives, women of childbearing age. We have a repeated census, so we can measure change over time. We also have some information on migration patterns as well, so how people are moving between different units. And in high-income countries, that's really just the start of the type of data that we have. We have these regular, reliable censuses with very strong mapping components. In the US there are millions and millions of different units that each bit of data is linked to. We also have strong civil registration vital statistics systems, so every single birth, death is registered. We have multiple other types of surveys, registrations, statistics. But in the low-income countries, what we really are relying on is the census data, and supplemented, as I'll show you, with surveys. But that brings up problems. So even that great data from Namibia was 2011. It's already 5 years out of date. More typically, we have this kind of situation where we have much larger level of mapping and a much older data set. This is from Central African Republic. And when we look across these low-income regions, you can see that broad spectrum there of different colors of the years since the last census. Dominating there is yellow, which is 6 to 10 years, and a lot can change in that kind of period. But in the worst cases, we've got over 15 years since the last census. Countries like the Democratic Republic of Congo, 1984, Somalia, 1987, Afghanistan, 1979 was the last census there. So we really don't know much about the populations there. So the challenge here, national census data is going to continue to be probably our most important data source. It's counting everybody. It gives a lot of information. It provides the denominators and numerators for the SDGs. We can project forward and back for them with some level of confidence, and gives us a lot of subnational detail. But that period typically only includes just the SDG period, just one census date. So if we look at the timeline at the bottom there, maybe a country in 2020 will have a census. It may take another year or two to actually process and get access to that data. That gives us a time point where we measure the baseline from as a question, and then how we measure progress all the way through that SDG period up to the next census right at the end of the period. And of course, in other situations, as I've just shown, that's much more challenging in those countries where we don't have a baseline and we don't have a prospect really of a more recent census. An example of where, operationally, where this kind of information is valuable. So in northern Nigeria here, this work in collaboration with the Gates Foundation. The aim here was to, of course, for polio elimination, is to vaccinate as close to 100% of under 5s as possible. So to do that, we need to ensure we've got the correct amount of vaccine to take out to cover all those under 5s. We need to plan those local vaccine needs and plan the vaccinator logistics and routes. So we need to know how many under 5s there are in each area, and to know how those numbers are going to change through time. I need detailed maps of the region. So starting with that detailed maps of the region, here we are in the Royal Statistical Society. This is Google Maps. We have every single building mapped out, streets named, McDonald's, all kinds of things mapped on there. We go to one of the biggest cities in Western Africa, Kano, in northern Nigeria. This is the center of the city there. We have one boutique, a road and a mosque, and some unspecified brown and grey blobs. If we go just to a few miles out to the outskirts of London, still every single building is mapped, every single road is named. If we go the equivalent distance out to the edge of Kano, where we know there's lots of buildings, lots of people living, there's nothing. So when the vaccination, or the polio elimination team wanted to achieve the 95% or 100% of under 5s being mapped, these are the kind of maps they were faced with, and this is one of the best ones. We have examples here. This is locations of settlements in different wards, and this is probably the most extreme example. Go to the playground, turn right, and you get to the Fulani camp. And in some cases, the maps looked good. They could divide up this region for team 19, 18, 17, and 16 in kind of equal ways. But when they actually took geographic GPS and drove around the edge of this map, this is what it actually looks like. Team 17 has some problems. And again, the numbers were based on projections from the census. We see two very similar settlements, 36 compounds, 32 compounds, but the estimates of number of people were 375 here, 2,675 here, and there are stories about money being allocated from the government by how many people you have living there, so it immediately calls into question parts of the census that everything is based upon. So what do we have to try and help us fix these things or complement what exists already? So throughout this talk, I'm going to talk about how we integrate some of the newer types of data. So geolocated household surveys, which are typically in the low and middle income countries undertaken every 3 to 5 years, national surveys. Satellite and GIS data obviously are being collected all the time, so consistently cover this SDG time period. And then mobile phone data, again, covering this entire period, though improving in sample size, you'll see. So household surveys, typically used to get statistics for these low and middle income countries in the absence of census data of registration systems, from demographic and health surveys, living standards measurements study from the World Bank, UNICEF's multiple indicator cluster surveys, and this can give us information like 53.1% of women in Nigeria are literate. It can be disaggregated and gives us this kind of picture, which immediately highlights some of the heterogeneities that exist in the country. But what we do have for now, for the last decade or so, increasingly GPS being taken on these surveys, so that each of the clusters of houses that are surveyed have a locational tag to it. And this means when we are now mapping out the proportion of women who are literate, we do have some much more refined data, much smaller sample sizes, but these patterns still appear, and we can immediately see at these scales, these grey areas are the urban areas, higher levels of literacy in urban areas than we see in the remote rural areas. And later on we'll talk about how we can use that kind of information. These data are available now widely across the low-income world, from not just the DHS program, but increasingly more and more survey programs. I'm just going to skip out of this because this video doesn't work so well here. But we also have increasingly geographic information system data. Where has it gone? So, that's not going to work. Sorry. Okay, maybe this will not work. Right, this should work. So, we can see here, if I just pause that a moment, this is Haiti, and it's pretty much, in terms of mapping of roads, of settlements, a similar state to what we saw for Kano, very sparsely mapped. But what we saw, the 2010 earthquake occurred here, and immediately we had a lot of people volunteering their geographic skills and time to contribute to the mapping, taking high resolution satellite images and digitizing them. And as a byproduct of this, Haiti is now one of the best mapped low-income countries in the world. We have an incredible amount of detail. And that kind of level of detail of mapping of volunteer geographic information data is increasing all the time and helping us fill some of those gaps that I've shown already. So if I go back to this. So we have things like the Missing Maps program, OpenStreetMap, which are now providing information down at individual buildings being mapped. We have national statistics agencies starting to digitize a lot of their data. So road networks here, location of villages. We have aid agencies, refugee agencies, UN agencies digitizing things like refugee camps, location of them, estimates of number of people. And we have now social media even being increasingly GPS tagged. So this is location of geo-tweets, or geotagged tweets in Indonesia, immediately showing a distribution of densities of the population. It's one of the highest tweet per capita rates in the world in Indonesia. We also have satellite imagery coming in to help us. So here we have topography, we have satellite images of the Earth at night, Pakistan. We have images in different parts of the spectrum that can identify crops, that can identify vegetation. We have very high resolution images now. We can identify individual cars on the road, different types of buildings. And this, as you'll see, is actually a movie. There are now satellite companies that can, in a kind of sci-fi style, film movies from space. So the third type of data, mobile phone call detail records. 10 years ago, this would have been not a great data source. You can see that mobile phone ownership is down at around 10% for some of these low-income countries that we're interested in. But today, they are right up at a similar level to the US in terms of mobile phone ownership. Over 500 million phones, and an increasing number of smartphones as well. So what can we do with this kind of data? Well, if I was to make a phone call now, or received a call, that would be routed through the nearest mobile phone tower, which is probably on top of one of these buildings. That's recorded for the time and location, the time of that communication, and the tower that it was routed through for billing purposes. If I then moved to somewhere else down the street and made another call, that will be routed through a different tower. And so the mobile company has information there, anonymously, that I moved from one location to another by my calling patterns or receiving communications. Of course, across the millions of people that now own mobile phones, we have quite an unprecedented rich data set of movement patterns. Of course, there are still biases here. It's still the richer people, the more urban populations that own phones. But as you saw with that steep rise in phone ownership, those biases are slowly disappearing. And this data can not only be used for getting movement patterns, but changing densities, information on social networks, the number of contacts people have, the calling patterns, and also consumption. So the amount that people top up their phones by credit. And of course, this is also very sensitive data. So when we work with the data, it's always aggregate summaries that are output. Raw data never leaves the operator, and everything has to go through quite a stream of lawyers and regulators. So altogether, this gives us this kind of pile of data that I'll keep showing throughout the talk. We can have things like the traditional sources from census. We have those geolocated surveys. We have GIS data. We have satellite imagery and ways to process it to extract useful information. And then we have the mobile data as well. So throughout, I'll talk about how these data sets can be integrated with traditional sources to make use of them. So, how actually can we make them useful? So firstly, is the SDGs again. As I said before, all of these SDGs are based on ensuring a certain percentage of the population has access to services or a certain level of health. So we need accurate, subnational, consistent, ongoing data on denominators. So how can we get there? Using census data plus some of these newer data sets. And this brings in, firstly, spatial demography, which is a growing field. And here we divide up the world into grid squares. Gives us a consistent and comparable format and a framework for integrating different data sets. And for each one of those grid squares, we want to estimate how many people are there, their age and sex structures, and how things have changed, as well as how mobile is that population. And to get there, we're starting at this stage of census counts, typically aggregated at coarse, irregular admin unit levels, and those boundaries can change through time. They can be different for different measurements, different data sets. So it makes integration and comparison with other data sets challenging. So here we are integrating with all of these different spatial data sets, the satellite and GIS data that relate to how humans distribute themselves on the landscape, to disaggregate them into regular grids. So just an example here for northern Vietnam. Here's the population densities in that region, strange irregular units. What we do have is for each one of those units we have a measure of things like land cover. We have the Earth satellite at night that obviously shows in some areas where people tend to live, or where at least they're electrified. And then we have satellite data that's been processed to extract where humans settle. So we can bring all of these together to learn the relationship between the densities here and all of those different layers to come up with a disaggregation to a gridded picture. And this gives us a consistent way of mapping out population distributions across the world. Some close-ups there, and of course validation against ground data or cross-validation are pretty important here to make sure we're not increasing the error by doing this disaggregation. Some examples there. Of course, mapping population through time is an important component of this if we are to provide these denominators for the SDGs. So on the right there you can see population for the coast of Kenya mapped throughout a 30-year period or 40-year period. And also on the left there, China's population changing between 1990 and 2010. Some huge changes. And if we were going to then look at what might happen towards the end of the SDGs, we also need to integrate things like urban growth models. It's difficult to see on the colours there, but we're integrating in those models into the future projections of population. And for each one of these, the gathering together of census data, each one of these units, of course, through the census we have estimates of age and sex structure, which can be used to adjust those population data sets to come up with things like women of childbearing age. And again, in our stack of data, we have these survey data which can give us age-specific fertility rates, to then further adjust those to estimate numbers of births and numbers of pregnancies per grid square with associated error around them. The benefits of having these kind of data, as I said before, the grids give us a consistent and comparable format. And if we want to go back to aggregate administrative unit levels, which often many decisions are made at, it gives us that flexibility to summarize back to those levels. But also it gives us a way of combining different types of data set. So here we have distribution of women of childbearing age and the locations of obstetric and neonatal care facilities. And we can do analyses such as looking at percentage of women of childbearing age within 50 kilometers of one of those and identify where are the gaps, where might a new facility or upgrading an old facility give us better coverage. So that's great if we trust the census data. Of course, we have these red, orange, yellow countries where maybe we don't trust it so much, or we really don't have census data to work with. So what can we do there? So this is where the very new types of satellite imagery come in. Satellite images are around 50 by 50 centimeters or 30 centimeters on the ground now. So we can pick out individual buildings, the smallest of huts, and with the computing power of places like Oak Ridge National Laboratory, can process these huge images to identify using, again, machine learning type approaches and pick out, it's working, they can pick out the individual buildings and settlements, and that's really the starting point of being able to map populations in the absence of a census. And there are now multiple other organizations who are doing this. We have Facebook, Airbus, all getting involved in processing these types of very high resolution satellite imagery to extract buildings to understand where people are. Of course, that gives us just where the buildings are. It doesn't tell us how many people are in them. And this is where more processing of the imagery can come in to help us identify different types of neighborhoods within countries, within cities. Here we've identified in Kano, again in northern Nigeria, different types of neighborhood that stand out. And we can use these then as training for the computer vision approaches to extract where within Kano are those different types of neighborhoods. And then we can go to each of those neighborhoods and each of those rural areas and do small area counts of how many people are living in each of those to give us training data to understand what are the typical population densities in each of these areas. And then combining with, again, other types of data set that can be informative of how populations distribute themselves on the landscape, we can get a pretty good prediction of population distributions in the absence of doing a full census. So a much cheaper, much quicker way of estimating populations. And of course, it's pretty important here, given that we are based on small area training data, to do this in a Bayesian framework to come up with upper and lower confidence intervals in our estimates. But ultimately, we end up with a 90 by 90 meter grid squares here with an estimate of number of people living in each. So that would be great, but people don't stay still. So we face another challenge. And with populations moving around, this has an impact on our denominator estimates. People are moving around seasonally. It changes our estimates there. That can also have a knock-on effect to our health and development metrics. The demand for services, if there is a seasonal migration to an area, it can be a big demand on a service for a certain time of year and not another one. Identification of those vulnerable populations, so nomads, migratory populations can often be the vulnerable ones. And of course, movement impacts disease dynamics and is a byproduct of disasters and responding to those and giving relief. So how we actually measure those movements, we have traditional data sources. So we've talked a bit about the census data, which can measure migration, with cross-border and traffic surveys, which can give us specific crossing points. Household travel history surveys can give us the movement patterns of a very small sample of people in specific locations. But these new sources can give us some complementary data to add into the mix here. And I'll talk now quickly about these phone data and satellite nightlights. So firstly, migration, the longer scale of things, just how we can again use our stack of images and data sets for some of these countries where that have undertaken a census and collected migration data. We we get flow data on how many people have moved from one location to another. We have this whole area of grey where we don't know. But here we can make use of spatial interaction models to look at what are the driving factors that mean that a lot of people are moving between this location and not so much to these others. And it's distance, it's things related to agricultural productivity, related to urbanization, related to factors that we can measure and map in our stack of data sets. And through that, we can build models and maps of those internal migration flows across 5-year periods. That's great, but can we actually get a finer temporal and spatial detail? And what we've turned to in the last couple of years in one direction is these satellite nighttime lights. So you're probably quite familiar with this picture of the Earth at night. You can zoom in here to North and South Korea and see South Korea. You see Kim Jong-un's house, I think that probably is. But these images are also collected every month, every day, in fact, and clouds get in the way, but if they're aggregated enough, you can see interesting trends occur. So this is the impact of the war in Syria. What we were interested in was the huge seasonal movements that occur across the Sahel. There were anecdotal evidence of a lot of people moving into the cities during the dry season when agricultural productivity in the north is poor. We wanted to know, could we measure the timing and relative size of those incoming migrations using satellite nightlights? And the answer is yes. As people move in, they turn on lights, they light fires, and we see those cities get brighter and see them in those specific areas where the migrants are moving in. So that gives us one measure, but can we get even finer spatial and temporal detail? So here we've got a little movie of the value of mobile phone data. So this is not a low-income country, this is France. And what we can do is map out the density of mobile phone users and then train a model against census data to convert the density of SIM cards or users into population. And immediately you see the major cities, you see the kind of population distribution that you would expect. But the benefit is that we're collecting this mobile data every minute, every hour of every day, and we can see those repetitive fluctuations as people go into the countryside at weekends and in urban areas are working in the weekdays. There's Saturday and Sunday, and we can fast forward now to the holiday period. Everybody in France goes to the coast. There's a few hot spots in Versailles and Disneyland in Paris. And then I think towards the end of August, everybody eventually moves back into the cities, depressed end of holidays. So, as data are valuable for France, how about the countries that are weaker in their statistical systems? So, initially we've looked at how this data compares to official statistics as a kind of validation. We have the migration report from the Namibia census in 2011. We had mobile data covering pretty much exactly the same period. So we could look at, did typical mobile phone users who moved location within that year that their migration report asked about migration, did that correlate? And it does pretty well. So it's an indication we can potentially use these kind of data for providing support, complement official statistics on migration. We can also do a similar thing that we've done in France. So this is population density change per square kilometre. Around December time, we see a huge movement out of Windhoek, the capital, to the northern regions where people's families are typically from. And then January time, movements back again. And this is population density change per square kilometre. So it's huge movements going on across the country. And these fluctuations occur throughout the year. And we've really had no way to uncover these before. So one way is this useful? One way, working with the government here, is health facility catchment populations. So we have those delineated here and are able to estimate there's number of people within each catchment at each month of the year, and giving an idea of what the demand that might be on the facilities. And those can change substantially depending on the region. So I think that covers denominators. There are ways that we can get around and complement existing data sources, try and fill gaps with satellite data, with mobile data. How about the other side of things, those numerators? So here I'll just focus on the first 4 targets here: poverty, hunger, good health and well-being, quality education, and in particular some of these targets that have quite measurable outcomes. So eradicate extreme poverty for all those people living on less than $1.25 a day, and all forms of malnutrition, particularly stunting and wasting in children under 5 years of age, universal access to sexual reproductive healthcare services, and ensuring that all youth, a substantial proportion of adults, men and women, achieve literacy. So what can we use to help us get to those numerators? Again, those 3 types of data can come into play. Starting with goal 1 on poverty. Poverty mapping is a pretty well-established field, and that the World Bank uses as this small area estimation, where survey data on poverty rates are then combined with census data, which has a much larger sample size to map at those small areas. So that's great, but again it suffers from the same limitations, as that we can do a poverty map for the census period as long as the household survey data are a similar time. But many of those countries, we don't really have that kind of data to do this. So here is where, again, the integration of the different data sets can come into play. So those population characteristics that can be measured from household surveys can be quite strongly related to features that we can measure everywhere through GIS data, through satellite data, through mobile data. So we can try and use those relationships to predict those characteristics at the places we haven't gone and done the surveys, using those different metrics. Of course, there's importance here of validation and mapping of the uncertainty. For an example here, this is survey data on poverty rate. In the urban area here, we have much higher rates than we do in the remote rural areas. So increasing distance from roads is increasing poverty. Increasing urbanicity, decreasing poverty. These are messy relationships, but they do exist. And similarly, from the mobile data, we've seen studies looking at the amount of movement across a population. Greater mobility generally correlates to lower rates of poverty. A wider social network, again, correlates to lower poverty. And a large and regular credit top-up correlates to lower poverty. So together, all of these things from the stack of data can hopefully inform us and give us a way of measuring and mapping poverty in the absence of needing a census. So again, here we have the GPS located cluster data for Bangladesh this time. We have our data sets on things that can come from GIS and remote sensing, the distance to roads, satellite nightlights, vegetation, temperature, precipitation. But we can also process the mobile data to get information on things like amount of mobility, the amount people top up their credit each week, the number of SMS messages they send. And then build a statistical model. This is about as complex as it gets with the stats in this talk. Each cluster level variation we're representing by a sampling model. They're small sample sizes. We're building the relationship with these geospatial covariates. We have a spatial covariance matrix to account for spatial autocorrelation, and then we have a noise term to mop up the error and uncertainty. And ultimately, this is what we come out with, a pretty good relationship from cross-validation. Of course, the benefit here is this is based on cell phone and satellite data that are collected 24 hours a day, 7 days a week. So the potential is there for doing ongoing monitoring. And it's not only poverty that this can be done for. So going back to the polio problem, trying to identify those under 5s. We've used the satellite data to get a map of population counts. Survey data can give us information on the proportion of the population that's under 5. Again, we see these spatial patterns inherent in the north-south divide and urban-rural divide, and we can exploit those relationships with things like travel time to the nearest settlement, with satellite nightlights, with vegetation. And it's surprisingly predictable, proportioned under 5 in Nigeria using this combination of data sets. And we can ultimately produce a prediction for each grid square of the proportion of the population under 5 and the confidence interval around those estimates. So in some areas where we don't have surveys, we're much more uncertain, and in some areas where those surveys conflict, we can be a bit uncertain. But in many places where we have consistent surveys and we have a good density of surveys, we're pretty confident in those estimates. Similarly, this can be done for things relating to goal 2, stunting in girls and boys. In this case, can be used to skip through some of these maps, but we have uncertainty maps around these, which show a pretty good relationship. And the value of these kind of things, again, another add-on is we can link these with different types of data now. So how is aid being equitably distributed according to needs? This is aid for tackling malnutrition. Is it being distributed in the place where the stunting is highest? Goal 3 on reproductive health. Yeah, we get a pretty good relationship, predictive capacity at percentage of women of reproductive age using modern contraceptive methods. Importance of uncertainty again around those estimates because they're not all perfect. Maternal health in goal 3, probability of 4 or more antenatal care visits, proportion of adolescent births, and vaccination coverage, again in goal 3 of improving health. We can, again, those kind of surveys are measuring vaccination coverage, and we can integrate those with demographic models to map out, in this case, the likely number unvaccinated due to the Ebola interruption. Finally, literacy. Again, going back to the very start there, the percentage of women and males who are literate. So finally, I'm going to talk about these other goals in here, which are related to resilience and risk reduction. So these are a bit more, I guess, fluffy, less to quantify. But it's all about strengthening the capacity of early warning and measuring adaptation, resilience to disasters and climate change. And here is where the mobile data can come into play and help us. So again, we can measure population movements across different scales using these type of data. So this is for Accra in Ghana. We see a similar type of pattern as for France, people moving into the countryside at weekends and back into the cities in weekdays. In Kenya, across months, we see different changes in movement patterns, and those differ by different regions. So the more Muslim northeastern region has a very different movement pattern to the rest of the country. And then specific events, this is change of flow during Chinese New Year, huge movements into the countryside, back to where people have originally migrated from. And one particular application here was the earthquake in Nepal. During the quake and the aftermath, there's pretty much chaos everywhere. There is no good numbers on really how people are being displaced, where people are fleeing to. There are occasional surveys, and then there are estimates like this that come out. Daily exodus may reach 300,000, can be huge. And this is where these kind of data can come in. Because of our relationship with the mobile operator, we were able to set up a server within 2 days of the quake, analyze the flows before and after that quake, and then produce a report within 10 days of the quake. And this is the kind of thing that was ultimately produced, providing estimates of the number of people who were displaced from different regions where they were going to guide how aid and response was distributed. Again, Bangladesh, the impact of climate change, the impact of climate events. We saw a cyclone come through, and because of the dynamic monitoring of this kind of data, able to look at how populations were reacted to that and were displaced. And this kind of data also improve our ability to predict disease dynamics. So, and this is rubella dynamics in Kenya. We have it's a very seasonal disease, and typically the models that have been used to predict and model this have been based therefore on school closing and opening times, on rainfall patterns, but it's only when you add in this population flux from the mobile data that you get a much better predictive capacity. Again, cholera dynamics in Haiti. Even the best models that were fitted using retrospective data from the outbreak were not as good as those driven by the mobile data and the movement patterns from that. And the reasons behind that are likely due to the kind of standard models predicting small amounts of flow out of this region in Pakistan, when what we see from the mobile data is much more movement than we would have expected. And those kind of models, based on the mobile data, can then be used to try and understand what might be happening in surrounding countries. So this is a model of movement patterns based on data set from Senegal and from Côte d'Ivoire, trying to understand the connectivity for the Ebola outbreak. This data can also support disease elimination strategy design, so goal 3 here. This is the hotspots of malaria transmission in Haiti. In the 1930s, people went around trying to clear out these hotspots of parasites by giving everyone drugs and then moving on to the next hotspot, moving on to the next hotspot. Of course, people from other hotspots were always moving around and restarting transmissions, so they were just chasing their tail. With this kind of data here, we can understand now the connectivity and how people move around and connect up those hotspots and design strategies more efficiently. And similarly across Southern Africa, which is working as a region to try and eliminate malaria, the movement by people through a mobile phone-based model and linking that with transmission data to understand the movements of likely infections. Ultimately coming up with actionable maps like this of identifying where are the sources of infections, where are the sinks, and by targeting those sources, you'll likely have a much better bang for your buck in terms of impact on the country than targeting those sink regions. So, ending here with maybe I'm sitting in my academic ivory tower in Southampton. This is not Southampton, but maybe these will never find use. Well, some of them actually, we're seeing the starts of them actually being used, and some nice examples. So we have, for instance, the recent report, the World Malaria Report, is now based on great work done at the Malaria Atlas Project on mapping change in prevalence and linking that with population data sets to give us a much more refined picture of numbers at risk. The birth and pregnancy mapping is used within the UNFPA's State of the World's Midwifery. In disaster response, we're now seeing gridded spatial data sets used to estimate numbers of people affected by major events, earthquakes, hurricanes. We have UN agencies now actively using these gridded data sets to design surveys to understand humanitarian needs. And the analysis from the ongoing analysis in Nepal are used by different agencies to direct responses. And then finally, operational support and strategy design. So there is analysis from northern Nigeria now used as part of the vaccination tracking system to guide how that vaccine is distributed, to work out the routes that people take. We have financial services being planned based on the poverty maps. We have the malaria elimination efforts being guided by this kind of mapping to prioritize specific areas to target for spraying. And we have ongoing work here with the government of Afghanistan. The last census was in 1979, to use these bottom-up population mapping approaches to produce new estimates of numbers in the country. Of course, this is underlying all of this is the importance of training, of local capacity, and it's good news. I mean, GIS, remote sensing skills, capacity are increasing everywhere. When we go and do this training, we see a lot of enthusiasm and better skills each time. That's being partially driven by more and more open data and open software. Everyone here is using QGIS, and completely open data set that you can go and download today. And making full use of these existing traditional data that are collected and are stored at national statistics offices, and complementing it with these new data sets can be pretty cost effective than going to undertake a new expensive survey. And of course, this local ownership and analysis is key to this. We don't want to be continually making maps for these countries again and again. Ideally, this will be taken over by countries themselves. So I will finish up here, just to summarize some of the things I've mentioned. So in producing these estimates of different geographical scales and time periods, the integration of these different types of data to complement those is often required if we're going to make estimates for monitoring, measuring throughout this 15-year period. These novel data sets are all prone to biases, but each has some advantages over census data in terms of frequency and measurement, spatial precision, and of course methods to account for those biases and the importance of statistics and reporting these uncertainties and making sure everything is clear in the documentation to inform users is very important. But hopefully I've shown here there's a great potential in complementing those traditional data sources to build not only a strong but quite a cost-effective demographic databases for measuring progress towards these SDGs. So this was mostly work done by the team at Southampton. So acknowledgements to them and the various partners, mobile companies, funders who support all of this work.
I did wonder with some of your correlations, I'm aware that, for example, South Africa, which for sub-Saharan Africa has probably got about the best census, that there are huge reservations about the census quality of particularly infant and neonatal mortality under fives. So when you're saying this is what we can do, this is what we can do back to what we've got, although we know what we've got is not very good, is that right? Yeah, I think I guess there's two routes I presented here. One is making use of traditional data sets and assuming that they are correct and good, and adding value to those by disaggregating to a more consistent data set. And then there are other approaches that if you really don't trust the census, you have no confidence in it at all, then there are other approaches if you're undertaking your own survey or making use of the satellite data sets to try and build a bottom-up measurement. But again, if you don't trust the census data, if there are metrics for how much you don't trust it, or you have good validation data sets, that's very important to be able to then feed those into the models as outputs to give you those appropriate confidence intervals around them. So I think there's still a lot that can be done with those traditional data sources, even if you know there are problems with them. If you can measure those problems, then you can fix things.
Hi, I was just wondering what you thought sort of continuing trends in around the commodification of data and data privacy would have on the ongoing use of mobile phone data.
Good questions. So there is commodification, I guess, in the commercial sense. We see more and more applications where data sold to UK data sold to Sainsbury's or Tesco's to analyze customer habits. In terms of the other side of things that we presented here, there is still, I think, an appetite within the mobile companies to do good with their data. More and more of these companies are setting up commercial and social responsibility sections and interested in giving something back. I guess it's a cheap way of getting good PR as well, to be cynical. But it's we are seeing more and more of these companies willing to talk to us and willing to do things with their data, providing the right legal frameworks are in place, providing protection is in place. And the thing they're probably most scared of is their competitors. It's that data is the kind of lifeblood of the company. So if we have a model in place that keeps them happy and gives them the benefits of doing good, I guess, then they are willing to talk. But you're right that there are some companies who are just closed up and only want to do commercial type analyses.
Thank you. I'm Claire Melamed from the Overseas Development Institute. So first of all, I just want to thank Tatem and the Royal Statistical Society for inviting us to collaborate on this. It was great, fantastic lecture, really, really interesting. And my question to you follows on very much from the previous question. We hear a lot about the sort of academic experimentation in this area, and it's really, really exciting. But I think it's safe to say that there's a lot more skepticism in sort of political circles, and not surprisingly, the adoption of these sort of techniques as a matter of course by governments and other official agencies is inevitably going, in some ways correctly, going to be slower. Now we know that access to the data when it's held in private hands is one of the barriers that's preventing these techniques from being more widely used. But I wonder if you can just speculate a little about what the other barriers are, and obviously most importantly, what can be done to help to make these kind of innovations more useful in policy circles.
Sure. There are barriers from the mobile companies, I guess, are petrified of firstly offending their customers through the confidentiality of this type of data, and secondly through their competitors of them finding out something about their market. And these are big barriers. Where we have found a lot of success is through ensuring that data never leaves the operator. It's processed on site. And only aggregate level data that is approved by the operator, by the regulator, ever leaves. And often those aggregate level data are the type that are of use for these national statistics, for making use of them. It's always going to be a challenge. I think this is because it's such important data for the mobile company. It's their lifeblood. Then they're going to hold on to it as much as possible and use any excuse not to give that data out. So yeah, you're right that there's going to be challenges, but I think there are some glimpses of light in terms of keeping them happy and keeping them open to share.
Hi, my name's Ben Rutledge. I'm working for the Ethical Trading Initiative, which focuses on labour rights and supply chains. My question is, have you done similar analysis on mapping progress with SDG 8 around decent work? And I know that some of the indicators of poverty lines and migration for work might feed into that. I wondered if you have any other thoughts or suggestions about that. Thanks.
No, we haven't. It's going to be a very short answer, but it would be, if you're interested to talk in terms of which parallels you can see there. Often in terms of the mobile data, at least, we have access for quite specific applications for supporting the Ministry of Health or for supporting national statistics, and so going out to a different application can sometimes be difficult and needs renegotiation of those terms and conditions. But talk afterwards.
Hi, Andy. That was really interesting how all the aggregate information comes together. Sorry, Maria Faraone, Oxford Brookes University. And I'm sorry, after all that aggregate information, to ask you another political question. I was really interested with the last slide, because having this knowledge is power, and having that imbalance where some nations or entities will have more knowledge could put a lot of power into other hands. So I wondered what that means. And just the other thing is, what intrigues me about all these maps is that all of this information really helps us to articulate better questions about why. So we really don't know why a lot of these things happen. And then the third part is, how far back can we go? So if we're measuring with such accuracy now, how far back can we go to the level of accuracy we had 50 years ago? So what's that timeline looking like in terms of accuracy and recognizing patterns?
Yeah, okay. Right, I've got to remember that. So Yeah, going back in time is, it's going to be challenging. There's some countries, there are censuses that were conducted 50 years ago, and if you go to the statistics offices, there are big dusty books on the shelves that you can get down and try and digitize the boundaries and try and extract the numbers into Excel and then map it out. So it is feasible to go back in terms of census statistics. Obviously, it's not feasible to go back in terms of mobile data, in terms of the kind of household survey, geolocated data. That's really only the last decade where that kind of precision has come in. So, I think there will be a gap that we can't go back, and that depends on the country. I'm going backwards. The second question was about I have to remind me. Politics of information power. Wow, this is going to be another whole 45-minute talk, I think. It's a good question, and I mean, I guess what we're trying to do here is make open data. So we're trying to take the data that is often held in statistics offices that you need some level of literacy to use, and produce data sets that anyone can use. And at the moment we're at a level, I guess, where you need some kind of GIS mapping expertise. But ultimately the aim, for instance, in the Afghanistan project, is to produce new estimates, new subnational estimates that will then be made available, openly available, and giving back then, I guess, the power in that way. But was that the first or second question? Sorry.
Daniel Horn from HelpAge International. I had a question regarding some of the gaps that are often seen, for instance, in the demographic household surveys, where a lot of the measurement stops at a certain age, say 49 for some. Well, I know the reason why, but they stop collecting data. And I know we focused a lot on mobile data for your work, but I also wonder about the use of fintech for financial service technology that's being used, for instance, in cash transfer systems to older persons, and how we start incorporating that into generating data that we can use, considering that in the developed world, about 8 out of 10 older persons in the world will soon be in the developing world. And they're not stable migration patterns. And I know we focus a lot on younger working age groups, fertility groups, but I wonder how we can sort of address that, and how we can push the agenda on generating the data that does not exist for a population that's going to be quite sizable in the future, and especially in the areas that we're now currently trying to reach. Thank you.
Another great question that I don't think I have an answer to, but as you mentioned, that there are other sources of data that we haven't considered, the fintech type data, that again could provide a valuable data set to feed into a demographic model that does potentially fill in that gap that the surveys don't cover. I don't know how to do that. I'd love to get your ideas, but sounds great.
Thank you. A very impressive review of the existing data to measure development goals, but there's something behind this, in my view, the factors influencing those goals. Take population, for example. What work is being done on the factors that influence poverty? Example, corrupt government, barriers to trade, as well as the ones you've listed here of education and health. Thank you.
I think our focus is on building those evidence bases first of describing poverty, that then enables these kind of analyses, I think, to be undertaken. We think we know some of the causes. We think that there are a lot of speculation, but I think only when we have that data to be able to quantify and explore some of those relationships, we have a better idea. And if we can go down to smaller and smaller scales and understand why there are certain hotspots of poverty in certain locations and not others, that's potentially where the targeted interventions can come in to tackle those kind of things. But yeah, that's another good question. There's a good string of questions here that I can't really answer.
Neil Jackson from DFID. Thank you very much for a sort of really stimulating presentation. And particularly, I think it's a very powerful demonstration of how you can combine data from traditional sources with these new sources and new sort of software applications to really sort of enhance the information that's needed to sort of track progress against the Sustainable Development Goals. We had one or two questions about the importance of getting this information into the hands of policymakers, but I think there's also a challenge in terms of how within developing countries, those who produce the statistics can be sort of empowered to sort of embrace these sort of new opportunities. And there's a lot of sort of challenges with that, but you mentioned towards the end of your presentation the importance of this analysis not just taking place within places like in the UK or Southampton, but also how you get this analysis taking place within these countries. I'd be interested in what your experience has been in terms of collaborating with national statistics institutes in developing countries, and what you sort of see as the sort of opportunities and challenges perhaps in terms of how one might collaborate more to help those countries sort of, the statisticians within those offices to sort of start getting engaged in this sort of work.
Sure. I guess my most recent experiences with running training for the Afghanistan National Statistics Office, and there was really a huge enthusiasm for learning these techniques and learning the approaches, but a big barrier in terms of accessing the training that was needed. That there was one or two people who had access to a GIS. They were quite amazed when they saw that there was one they could download for free. So immediately that's changing things. But yeah, there's a real hunger and enthusiasm, I think, for learning these types of approaches. There are already a lot of skilled people in the country for making maps and just using maps to send to policymakers. There's a bit of, I think, a barrier in terms of knowledge of how that you can use these maps to go further, to integrate them with other data sources, to process them, to give different outcomes and different ways of guiding interventions, of creating statistics. So I think there's first, from that experience, firstly there's the hurdle of getting over showing people what can be done, and the system there meant that they don't get much outside input to see the latest of what can be done. So yeah, I think giving them exposure to what can be done, and then understanding what their needs are, and giving that kind of training that enables them to do that. So yeah, there's a lot of things that can be done, and I think it will depend very much on the country that you go to. We had very different experiences in East Africa recently, where there was a lot of enthusiasm, but also at a very high technical level already. And they're already feeding in subnational data sets into health management information systems, and are way ahead of somewhere like Afghanistan.
Yeah, thank you. Dina Leadbeater, I'm a health information specialist, and this actually kind of follows on from some of the previous questions, talking about training and also awareness raising of the potential of what you've got, because working in the health field, a lot of the information work is done by people in the line ministries, in Ministry of Health, and also the people out in the districts and the local government. And so, and in practice, there isn't really in many of these countries evidence-based decision-making culture, probably quite reasonably because there hasn't been much good information on which to base it. Yeah. And all of a sudden there's this kind of giant leap that you've got things that could potentially make a difference. But have you got some experience or examples of trying to work with the people out in the field to show how this is going to make a difference in practice? Because if it starts to make a difference in reality, then that's what sort of generates enthusiasm to maintain this within the country and maybe generates the political will to continue it.
Yeah. So I guess an example is working with the Namibia Ministry of Health and the Malaria Control Program, where benefit for us has been working closely with the Clinton Foundation, whose role is to put people within the ministries of health to provide that go-between between the latest approaches and the people who are often overworked, understaffed, and have no time for even understanding what these kind of new approaches can do. And there it was quite beneficial in that up until 2013, their approach for malaria interventions was to identify a high-risk area based on districts. It covered 1.3 million people, and they just did their spraying uniformly across there. We were able to use a combination of the satellite data linked with the case data and the mobile data to identify here's likely your source areas of high transmission based on analysis of the case data. Go and prioritize those areas first. And that enabled the spray teams who are often rushed and didn't complete their entire run across the country to prioritize those high-risk areas first. It was very difficult to say that doing that has had a difference. It made it easier and cheaper for the spray teams, and cases in Namibia have continued to go down, but statistically proving that it was because we told them to go to different places. It's hard to say.
Okay, I need to apologise for my inability to recognise the exact order in which hands went up. And I do have my instructions on when we have to move along, but I'm going to allow two more questions. There's the man in the, I'm afraid you're all too late. I've already got several in my mind. The man at the end of the row here.
Yeah. Matthew Powell, Oxford Policy Management. This all relies on modelling, and some of it perhaps quite complicated modelling. If you think of, in the United States, they found it difficult to get acceptance to use even very simple modelling for to improve the census data for its traditional purpose of allocating representatives to states. How do you get legitimacy for using this modelled data for traditional statistical purposes, or is this actually about new uses of statistics, new purposes?
I think it's both. It's about adding value to existing traditional statistics. I don't think we're advocating for replacing traditional statistics. It's complementing, it's making better use of that exists. Getting legitimacy is it's a difficult one, and the way that we are trying to do that is by partnering with statistical agencies and UN agencies who are the ones who are creating and producing these statistics. It's a painful and much longer process than it would be if we just sat in our offices and processed data and produced some papers. But it's one that we think will ultimately produce impacts. So the Nigeria example is one where those numbers are now being used to guide how vaccination is being undertaken, and the discussions are ongoing now with the government and the statistics agency to work out whether these can be adopted. And there's a lot of politics involved, obviously, when you're suggesting new numbers or questioning the existing census numbers. And it's a similar thing in Afghanistan, where so at the moment they're using numbers that were taken from 1979, kind of projected forward linearly to today in some districts. So we are going to be producing new numbers with big confidence intervals around them, and even communicating what a confidence interval means, and not just to use the mean as your number is problematic. So I think, I don't think, again, we have a good answer to that, but we are in the process of slowly getting towards producing these kind of statistics and working with the governments to try and do that. I foresee all kinds of obstacles like those that you've mentioned.
Thank you. Final curveball question, and then you can have a drink with the rest of us. So I'm John Pullinger. Until recently, I chaired the United Nations Statistical Commission, which was thinking about how we, as an official statistics community, measure this. And my question is, from the experiences you've had, what more can we do together to get the financing for development communities to see data as a key piece of infrastructure that they should be investing serious money in, rather than what the traditional building bridges and all that kind of stuff?
I think, money talks for these governments, and if you can make strong cases that you can do more with less, and if you have a strong evidence base that enables you to target to specific places and even reduce your budget but do more, then I think you are starting to speak the language of the politicians. If you can show that you're saving money, then the politics come in of one district saying, why am I getting all this investment? Why is my neighbour getting all this investment and not my district? So I think there's still barriers there to be overcome politically. But if we can, with this kind of modelling, not just stop at here's a nice map that could be used for something, but then take it further of integrating with other data sources, tackling actual questions that governments are facing, and providing answers that can be translated into dollar numbers rather than people numbers, then we might be getting closer to getting them to listen. And I'd be interested to hear your perspective as well, though. Closer to this than me, I think.
But over a glass of wine, presumably.
Yeah.
Just to close, to indulge myself in a couple of observations, I absolutely agree with Andy. You can't overemphasize the importance of in-country training and capacity building, and that's why, in our small way, we're hoping in the RSS to contribute to capacity building in statistical expertise Africa-wide. My personal observations of working in Africa, but particularly in rural communities, is that two qualities are much more in evidence than they often are in developed countries. One is open-mindedness, and the other is public-spiritedness. And I think that's grounds for optimism. But as far as tonight's lecture is concerned, well, the fact that I've disappointed so many people who wanted to contribute to the discussion speaks for itself. Andy said he wasn't a statistician, he's a geographer, but I would like to suggest that he is a statistical scientist, and a geographer can indeed be a statistical scientist, and a better scientist for that particular character that he adds to his bow. But that was wonderful, Andy. We owe you a great debt of gratitude. Thank you very much indeed.